Can a knee support brace like one of these actually help heal Chondromalacia patella? Let me tell you a bit more about it. We've got a sleeve right here, just a basic neoprene sleeve. We've got a knee brace here that has struts on the side. It's got these like plastic bars on the side that have some flexibility to them. And then we've got this heavy duty brace that has hinges in the brackets on the side. So it's got hard parts made out of metal right here, and there's hinges on the inside, and we have hinges on both sides. They're double hinges so that they bend more like the knee. So let me explain just a bit more about how these things work and how it might or might not help you with Chondromalacia patella. In order to get an understanding though, you need to just understand how I look at Chondromalacia patella. Now, the term Chondromalacia means cartilage thinning or cartilage shrinking. And what they're talking about is the patella right here, the kneecap. Behind the kneecap is cartilage. The medical field people generally explain to patients that with age, with wear and tear, the cartilage on the back of the kneecap begins to thin out and wear down, maybe even become damaged. And so you get Chondromalacia patella. But I look at it a little bit differently. What I see is there's muscle imbalances. The quad muscles above the kneecap are too dominant and strong, and so it increases the pressure of the kneecap against the thigh bone, which is what compresses the cartilage behind the kneecap and causes damage and shrinking to it. And if you can take that pressure off, then you can allow that cartilage to heal. Under that framework, then you don't technically need a brace to fix the problem, because in order to take pressure off the kneecap here, you have to fix the muscle imbalance. That is the true fix. That's what's gonna heal Chondromalacia patella. But a knee brace might help to give you some temporary pain relief. And so when looking at the different types of knee braces, here's what you need to know about them. I've got a sleeve here, just a regular sleeve. I'm gonna put it on just so you can see what I'm doing with it here. Some have holes in them, some don't. Obviously this one does not, but it's got this different pattern in the fabric to tell you kind of where the knee is supposed to go, where the kneecap is supposed to go. The compression factor from this can give people the appearance or the sensation that they get some relief from their knee pain. And the reason for that is because of the sensation, the pressure that it gives. It can shut off the pain sensation temporarily. For some people, that might give them enough relief to avoid having to take medications, avoid visiting the doctor for an injection, and this could be helpful, but it usually only helps people for weeks at best. Because if you're wearing this for 2, 3, 4 weeks, it tends to not give you the same kind of benefit that it had at the beginning when you first put it on. Now, some people want a bigger brace or something that has a little more in the brace, like the one that has the struts on the side. So let me show you that one next. I'll put it on so you can see what I'm doing here. This brace has a hole in it for the kneecap, so it's obvious where it needs to go, how to align it. You put it on your kneecap like so, and then you get the straps on. Just like this. Now here's the trouble with these knee braces is they all slide. They all shift on people, and you have to constantly be pulling it up and twisting it and adjusting it. And the kneecap hole, in my opinion, is kind of annoying because the kneecap moves. The kneecap has the ability to shift up and down. I mean, even if you just stand up, if you look at my knees here, watch this kneecap. If I tighten my quad right here, if I tighten this muscle up, the kneecap shifts up. So if I'm standing with a brace here and I've gone through all this effort to properly align the brace over my kneecap, and then I tighten my quad, now my kneecap is shifting out of the hole. So it's kind of pointless in my opinion. I don't think that it's a bad thing. If you are using a brace like this, it could still give you some pain relief because of the compression. But now these struts on the side might offer some stability side to side, which I think could be beneficial because it's going to restrict the amount of movement that you're going to go through, which is generally going to reduce the amount of repetitive forces that you're putting through your knee. You're just gonna avoid using your legs slightly more in most cases. Now, some people still go exercise full speed in these braces, if that's you, you might just experience the pain relief from the compression, but you might not actually be getting any sort of stability factor because the struts on the side are not super strong. I mean, I can bend them with my fingers right here. It's not giving you a ton of stability. Unlike this brace here, which you can't bend that very easily. It does have some give, but not a whole lot. I can't really bend that without bending the hinges. So it only forces movement in one direction. So let me get this brace on for you so you know the difference here. And at the end of this video, I will give you my recommendation on how to move forward if you have Chondromalacia patella, how to move forward with using knee braces. So this one slides in just like the other ones. And this, I like this brace because it's got these little pockets for your fingers to pull it up. And of course you want to align it with your kneecap as best as possible. It's going to shift and move around. I always tell my patients there's no such thing as a comfortable knee brace. They're all uncomfortable. Some are just more comfortable or less uncomfortable than others. But they all shift and move around. But sometimes they are necessary. However, with Chondromalacia patella, it comes back to that pressure thing that I talked to you about, the muscle imbalance. And so using a brace like this isn't going to take any pressure off the joints. The compression of it is going to help you out. And then this one does offer a lot of stability side to side. So if you have issues with the way that your leg is moving, if you have stability problems like with your ligaments, if you have loose ligaments or a torn ligament like an ACL or an MCL tear, if you have a meniscus problem, then this brace could be beneficial for you for those reasons, and it can help you get the pain down if you have chondromalacia related pain. Again, the root of the problem is that muscle imbalance, and this brace is not addressing it. So to sum it up here, we have 3 braces. I'll just leave this one on. We have the brace with the hinges, we have the brace with the brackets or the struts on the side, and then we have just the regular sleeve brace, the support. And all of these are going to offer you compression. This one's going to offer slightly more stability. This one's going to offer the most stability, but none of them are fixing the root problem. So move forward carefully in these braces. I'm not saying don't use them, but what I want to encourage you is I want to give you the best information to help yourself possible. So I want to encourage you to only use these braces if you're trying to avoid taking pain medications and trying to get some short-term pain relief, but don't forget to treat the long-term muscle imbalance. If you need help with addressing the muscle imbalance to fix the root problem of Chondromalacia patella, I have a program called the Patella Pain Recovery Program. It's my comprehensive treatment approach that focuses on addressing the root muscle imbalance to take pressure off your kneecap and allow that cartilage back there to heal, and then put you in a position where you can confidently go exercise and do all the things that you love without overloading your cartilage on your kneecap by having that muscle imbalance. You can find a link to this program in the description below. It's called the Patella Pain Recovery Program. And I'm also including down there a link to all our Chondromalacia videos that we have here on YouTube, so that you might go check those out as well and learn about different exercises, tips, and advice that you can do right now to help your Chondromalacia problem. Hey guys, if you like this video, please give us a thumbs up. If you thought this video was helpful for you and it might help someone else, share this with somebody, and please subscribe if you haven't yet, and turn on your notification bell so that you don't miss out on any helpful video that we post in the future. Thanks so much for watching, friends. I'll see you in the next video. Bye-bye.